A significant element of the rationalization behind the issuance of the executive order was the inability of the Rhode Island General Assembly to convene, given what appeared to be significant public health issues of meeting in person. Currently, the Assembly is in full session. They're actively engaged in a full range of legislative activities, including consideration of gun control, climate change, and the need for doulas and birth coaches. As the executive order clearly usurps representative government, why is the executive order still in place?
Because we're still challenged with a virus that we need to get on top of, so let's get everybody vaccinated. The more people get vaccinated, the more possibilities we are to have loosen up not only the businesses, but also on the executive order, and we're not even halfway there yet.
This is not a monarchy per se. I'm not conceding with that. A lot of this is based on your predecessor, but ultimately, doesn't the General Assembly have a critical role in determining the actions in response to this now that they are in fact meeting?
Yeah, and I'm meeting with them, with the Speaker, the Senate President, and other leadership, not only on the budget, but other related areas. So that process is continuing, and the people are being well represented.
There's no formal review process per se if, in fact, an executive order eliminates the need for legislative approval. And this is going to be critical, for example, when you've got the presence of possibly $1 billion, $2 billion, $10 billion, whatever, from President Biden's relief program.
I've answered that as well. We'll be working with the General Assembly on all those issues.
Doctor, we talk about micromanaging, and this is a lot of folks have evidenced a lot of frustration of this. For example, the change from 8 people to 10 people at a table. Now, in a state where, for example, we don't seem to have an agreed upon CTR, cycle time threshold value, in terms of arranging or arriving at our 2% infection rate, at a time when every established clinical trial has denied and disproven the efficacy of using masks. I think there's, what, a dozen trials been out there, randomized trials, thousands of people involved. How do we arrive at these seemingly, how many angels on the needle of a pin measurements do we get going from 8 to 10 specifically that has significant impact going forward on business?
We understand the science behind the virus and how the virus spreads. When you have larger groups of people together in close quarters, unmasked, engaging closely, perhaps in less well-ventilated areas, and with a variant that is continuing to spread, the risk for transmission is higher. Every step we can take to mitigate against that, to minimize the risk of that type of invisible or otherwise spread, is valuable to do. And the incremental steps that we have been taking to help release that are to make sure that we do it carefully. As I've shared, we are in a plateau. We are not still continuing to decline. That means the variant is still present, it is spreading, and we need to continue to be cautious in how we're proceeding.
Respectfully, at a point in time when Rhode Islanders were surveyed and there was an acknowledged near 96% use of masks, and I'm just using this as one example, I don't want to assess over masks per se, we had one of our biggest spikes. Despite continuing restrictions, we seem to have the worst of all worlds here.
Masks are effective. We can go to the next question, Brian.
How far along or how much of the current eligibility age group has been vaccinated, the 60 to 64-year-olds, the people with underlying health conditions? I know that was obviously a big group and a reason that the system got bogged down. How far along is that, and how confident are you that you're going to be far enough along when you open up that next eligibility group in a week and a half that it's not just going to overwhelm the system again?
Yeah, at this stage, we vaccinated about 45% of that next eligibility group, so we remain on track to open up to the next groups here in the coming weeks.
And we have baked out the numbers and the timeline based on an estimate of reaching about 70% vaccinated, so we're being very aggressive with that, and that is how we determine reaching that mark, knowing that we have achieved that with the previous age groups, is when it's an acceptable time to move forward.
Given the changes to the registration system and the vaccine supply, would you still warn people that it could still take a while to get an appointment in that next group on April 5th, or do you expect that to go significantly smoother?
We are always expecting it to go significantly smoother. That's what we're working 24/7 to allow to happen. As I have shared, we have relayed that within 1 to 2 weeks of your eligibility opening, you should be able to access the vaccine. With the increasing supply and the improvement in the experience, that should get better, but that's our baseline for right now.
One more. Providence, most of Providence and all of Pawtucket opened up eligibility earlier this week to all adults 18 plus. What are you seeing there in terms of hesitancy or people's willingness or lack of willingness to get the vaccine? And is the demand not there, or what are you seeing? Because in just talking to people in the community, there's surprisingly a lot of people who say, I'm not going to get it.
So what you just described is part of our high-density community strategy, which is also focusing on individuals, people of color who make up a large proportion of some of those communities. And our model is what occurred in Central Falls. We had our weekly conversation with our Central Falls mayor and her team today, and really showed when access is addressed, the rates for people 60 and older, 75 and older, can even surpass what you're seeing in other parts of the state. So our focus has been first and foremost on access, doing what we need to make sure that whether or not you have a computer, whether or not you have a car, whether or not you are working a job that gives you the time frame to get vaccinated, you will have the ability to access vaccine. Our second major focus is building vaccine competence. We want to make sure that everyone has the information that they need to be able to get vaccinated. We've seen by and large here and nationally, when you focus on those two items, you do get the type of response. We've had 70% plus response rates in our higher age groups, and we're going to keep doing everything we can to push on that demand, particularly as the supply is coming in.
Let's go Anita, then Steve, and Amanda.
I have a couple questions. First, there was a group of minority community leaders at the State House steps this morning. They say more needs to be done for the communities of color. DOH data shows 19% of vaccines have gone to people of color, even though they make up a third of the state. Do you think more needs to be done to fix this, Doctor?
Absolutely. We are very much aligned with what the community leaders have called out. Many of them are part of the Equity Council that I talked about before, who have been valued partners with us, holding us accountable, providing proposals on how we can make improvements. We have done a lot. There's more that needs to be done. And it does require this all hands on deck, as well as creativity and intentionality to help address the numbers that we're seeing right now.
And I have a couple little minor questions. We were told that it would be a waiting room function that would open up on the website. Does this pre-registration system replace that, or is a waiting room function also in the works?
Yeah, we've made several enhancements to the website over the last few weeks, so we've deprioritized the waiting room. We no longer believe that it's a function that we'll need in order to handle the traffic, and then especially as we get the pre-registration system online. So it's still there if we need it, but we think we've solved for it in a better manner.
Lastly, the mass vaccination sites in Woonsocket and South Kingstown, you said they will operate 2 to 6, I believe. Is that all like throughout the week? Because that's significantly shorter than the rest. And the other sites, Westerly, Johnston, East Providence, when will those mass vaccination sites open? When do you expect?
The regional municipal sites, so Johnston, East Providence, and Westerly, that should be in the beginning of April here, the next week or two, all dependent upon supply. The local municipalities are ready to go. As far as South County and Woonsocket, we're going to begin with 1 day a week, 2 to 6 p.m., but they're ready to expand to 5-6 days of operation as soon as we get additional supply in the state.
The other 3 are mass sites, though. They're just regional to be Westerly, Johnston, East Providence, or are they mass vaccination clinics?
They are vaccination sites. The scale will be a little bit different, and their days of operation, we're looking at a minimum of 2 per week once we get fully up and running. But those are led by collaboration of local municipalities.
Mr. McCarthy, you outlined how your expectation that the state is going to receive some additional vaccine next week. What do you base that on? And do you have any assurance that that's going to increase in the coming weeks? Or just a hope?
No, we do. So we've started to see some of the increases actually manifest themselves in our ordering process and system. So it's becoming concrete. And then we received reassurance from the federal government just yesterday that it's going to continue to expand. So we remain on track for what we've been forecasting and expanding eligibility.
Could you provide an update on homebound Rhode Islanders? How is that vaccination process going?
Yeah, so right now we have about 2,000 Rhode Islanders that are on the list of homebound, and we began vaccinating them last week, and we've already vaccinated about 15% of them.
Dr. Alexander Scott, good afternoon. What percentage of teachers have been vaccinated in the state of Rhode Island?
We are at about the 80% mark for teachers. We are continuing to build vaccine confidence by making sure that people are informed and educated. 80% is a very good number, so we don't usually associate hesitancy with that, but it's always important that everyone has access and confidence in going ahead and getting vaccinated.
Teachers have been offered the chance to have it, right?
Absolutely, yeah.
On the testing as it relates to percent positive, because I had this conversation with somebody last week, I would assume the numbers, and you can tell us, the numbers of tests every day compared to 2 or 3 months ago when we were really in the height of it and you were pushing asymptomatic testing, those numbers have gone down, right, in terms of the daily tests that we're administering or not?
No, it's actually something that we are quite pleased with. You are seeing the decrease in other states, but the energy that we have put into maintaining the demand for testing, really encouraging everyone here to every week get tested, has allowed us to hold steady with the number of tests. To be able to say today that we tested 20,000 people yesterday, which is similar to tests that we were doing weeks and months ago, is a true credit to all Rhode Islanders as well as to our team that has worked comprehensively and with Governor McKee to ensure that everyone who wants to get tested takes advantage of our state-of-the-art, nation-leading system.
Right, and you're continuing to encourage that.
Asymptomatic, absolutely. Whether or not you have symptoms, get tested. It's a way to protect your household. It's a way to identify, particularly with the variant here. We want to make sure people know testing, treatment, and vaccination are critical to getting us through this.
Doctor, good afternoon. You mentioned that we're seeing a significant onset of the variants here in Rhode Island. Can you sort of humanize for people the real danger of this? We're seeing this double mutation coming out in India. There's a lot of media hype on a national scale about the danger of variants. Can you just sort of humanize exactly what this means for people if they continue to adhere to protocols, what the likely outcome is?
Absolutely. I shared earlier that we have a variant response strategy team that's focused on this overall. A key is messaging and to help the public understand that variants are out there. Those mutations can normally occur. When they become variants of concern is when we see increased transmissibility. The variants are more contagious, 50% or more contagious than what they previously were. What we have provided to you all, though, are tools to help us get through this in spite of it. Testing regularly it's a powerful tool that everyone in Rhode Island has access to. We lead the nation in doing this. We want everyone to take advantage of it because it helps you identify and then be able to behave differently once you know if you've been exposed to COVID-19, particularly one of the new variants. Getting treated keeps you out of the hospital if you qualify. Getting vaccinated, we're in the top 5. We're going to continue to push and continue to ensure that our communities of color and everyone who needs access gets access to the vaccine. We've talked significantly about upgrading your mask, making sure that you're wearing them effectively, using the right ones, the KN95 or others. Masks work. They work, and they are extremely effective against the variant or any other form of coronavirus. Being aware of timing, limiting how long you're in a particular place, especially if the ventilation is poor, and making sure that you can expose yourself only to places that have great ventilation. Windows open, take advantage of our beautiful weather, go outside, take it outside. These are all strategies that we all have at our fingertips that will help us get through the fact that those variants are there.
I think this would be a question for Governor McKee. As you ease restrictions on outdoor dining, loosen restrictions on showers and gyms, and people get more vaccinations, do you foresee maybe loosening state restrictions on out-of-state travelers? And if so, is there a target date for that?
No target date, but as I mentioned last week, there'll be music in Newport and this summer, and that was done to let people know that we want to be open for business this summer. So we'll certainly take into consideration what's happening in the other states, and hopefully they're keeping pace with us on vaccination and other things that we're doing. And if they are, we're going to be welcomed into the state of Rhode Island.
Governor McKee, last week was Sunshine Week. I'm wondering, as we approach the end of the pandemic, your predecessor was towards the end not accessible to the press. I was wondering what your administration was considering going forward after COVID is over, that glorious day, if you'd consider continuing doing weekly press conferences and being available to the press.
Yeah, so we're going to continue. We've been available to the press. We've talked to many media outlets on non-COVID issues as well as COVID issues, and I would hope that we would be able to have a weekly discussion about non-COVID issues even before COVID is over.
Yep, Governor, Blue Cross Blue Shield of Rhode Island just rolled back their policy on stopping the full coverage of COVID-19 after you and Commissioner Teague had conversations with them. Can you just kind of outline to me what you and the Commissioner said to make them roll back and go back to fully covering COVID-19 treatment?
Well, I think the message was, as I said last week, and both Director Teague was doing as well. First of all, I had a meeting with both Jim Vincent and Pastor Jenkins after that press conference today, and they were concerned about that messaging that that communities thought that the vaccine was potentially going to cost them if Blue Cross or any of our health insurers reversed their position right now. So we want to make it very clear that the vaccine, there is no cost for that. And I would just say that they made the right decision. I think they reflected. They probably got ahead of themselves, and they made the right decision. And I'm happy that they are. As I mentioned, they've been a great partner for us during the pandemic.
Just a follow-up to that as well. Both them and Neighborhood Health Plan of Rhode Island said that they would continue to fully cover COVID-19 treatment as long as there's a state of emergency. Does that influence you keeping the state of emergency, extending it, or ending it at any point?
There's multiple factors on the state of emergency, right, in terms of making sure that there's a financial issue that we want to make sure that we're following, to make sure that the state is getting reimbursed for its expenses, as well as the health insurance, as well as the education, as well as having open government. So those all have to be factored in. And at the moment, as I said, we're not there yet. It's too premature to say mission accomplished at this point in time.
Secretary Pryor, Massachusetts has lifted their capacity limits on restaurants. They're at 100%. Any plans for Rhode Island to be at that point sometime soon?
We're pleased that we've been able to lift all the way up to 75% capacity, and we've also recently moved the table spacing from 8 feet to 6 feet. Also, we have bars open under restricted conditions, which are more extensive than what's available in Massachusetts. Having said all of that, yes, we're continuing to evaluate the public health conditions in close consultation with Dr. Alexander Scott and Rhode, and we look forward to a day when we can be at 100% capacity in the restaurant category, very important, and in other categories. Having said that, you heard the doctor, and I think we all need to pay attention to these points. The variant seems to be spreading substantially in the region. And even with vaccinations accelerating, we're seeing stability in our infection rate, in our positivity rate, but not a decrease at the moment. What we want to make sure of is we make those changes that are possible as rapidly as possible while not creating instability in our public health conditions so that we have to in any way think about further restrictions. So that's the balance. Again, having said all of that, we do look forward to a day when we can be at 100% capacity, and we're monitoring very closely to see when that can be.
Governor, is there a specific variant that you're looking at? I don't know if it's just the UK variant or some of the other ones that you're worried about. Does the vaccine protect against all of them?
B117 variant is what I'm referring to as being present here in Rhode Island, which is analogous to the UK variant. That's what has been identified. But we know that there are other variants that are present. As far as we know, the vaccines, by and large, cover the variants. The effectiveness may change a little bit, but it still achieves the goal of keeping people out of the hospital and keeping them alive. It's also, though, why it's important to emphasize, in addition to vaccines, continue to get tested, continue to get treatment, wear the best upgraded mask most effectively that you can, and get outside. Let's enjoy some of this weather.
Significant climate bill on another note. Sorry. Thanks, Jim.
Either way, where is the Department of Health on spectators for both high school and college sports? And looking down the, a lot of parents are listening to this who kind of got robbed of watching their kids during winter sports. Outside, things are getting better, and it's kind of like we saw the nursing home hesitancy. The Department of Health said you can do this, but they necessarily didn't. Some superintendents may be listening to this. What is your message to them, and by extension, the parents?
And for college or for
both?
K through 12? At the college level, we have supported the collegiate authorities in the best way to approach it. For K through 12, we have, in partnership with the Interscholastic League, who has been amazing with us through this, and I also want to thank Director Coit, Janet Coit, and her team that have been phenomenal in engaging our partners so that we have the types of outcomes that we need to have. Spectators have been allowed in limited numbers in those specific situations, and we can get to you the details of where we are offline.
What do you foresee for graduations, high school graduations?
We're still working through that. We intend to have it align with where we are with venues of assembly currently, but want to continue to work with our education partners on determining what will be the best approach.
Governor, on another note, a significant climate bill passed the General Assembly. What are your thoughts on that? Are you going to sign it? I know Republicans were concerned about a potential cost to homeowners.
Yeah, so we're reviewing those very issues on both sides of the argument, but look, this renewables is going to accelerate at a very high rate, and we all got to realize that that's going to happen. So we'll be reviewing that, and once we receive it from the General Assembly, we have not received that yet. I would imagine the first week of April we'll have that.
Mr. McCarthy, Attorney General in Rhode recently opined that it was inappropriate for board members at Lifespan and Care New England to receive vaccines. Do you share that view?
I mean, my focus is on vaccinating those eligible Rhode Islanders as quickly as we can, so hasn't been something that I've been able to spend too much time on.
Following up, do you think the Rhode Island Department of Health should have had stronger policies in place? Because the Attorney General said that was one of the reasons why they were able to get those vaccinations ahead.
Yeah, it's appreciated. The first portion of our vaccination campaign, as everyone understood, and we saw the tremendous outcomes from that, was to keep people out of the hospital and to keep them alive. A part of that was making sure that hospitals maintain the capacity that they needed and could use the vaccines to preserve their hospital system. There's a large variety of individuals in a hospital that are critical to keeping a hospital system functioning. So we instructed the hospitals to go ahead and vaccinate those individuals that they felt would be critical to keep hospitals functioning. We did not envision that board members were a part of that group. Once we did learn of that, we asked the hospitals to redirect their vaccines to those who were outpatient providers, because the hospitals have been great partners in helping to get other communities vaccinated. And the Attorney General's input on specificity is definitely helpful, and it's certainly something we would take into consideration for the future if we were to have a similar situation.
Governor McKee, last week you committed to a 70% vaccination rate as a benchmark, if you will, to completely reopen the economy. Two questions. Number one, how close are we to that? And number two, what are you measuring 70% of?
Well, first, I didn't say completely, but the 70%, we're, as Dr. Alexander Scott and others have reported, we're over 300,000 first shots, and we're looking at moving up to about the 620,000, 650,000 mark by, I think, sometime between, on first shots, sometime between mid-May and the end of May. So when we get to that level, we'll see where we are on all the other factors, but that's a key point for me on that issue. And I do want to just say, follow up on the press conference that was at the State House today. I did meet with both Jim Vincent and Pastor Jenkins on the issues, and there is an issue there, and wherever there's an issue we need to really address. If, for instance, the black community is at 3% of the shots, and they're at 8% of the 8% of the population, we got to ratchet that up. I think everybody would understand that. So, just as an example, if we did 300,000 shots, and they are 8% of the population, that population we should be closer to 24,000 shots with them, right? Being fair across the board. If we're at 10,000 shots, we've got some makeup to do. So that's the idea, to kind of put it into a math formula to make that happen. So.
Can I just follow up on the question of kind of line jumping with this current eligibility group of people with underlying health conditions where you don't have to show any proof? Have you heard either anecdotally or have any evidence of people cutting the line, faking that they have that? I know people are concerned that people are jumping in when they really shouldn't.
I think what we've seen so far is that Rhode Islanders have generally continued to do the right thing. We continue to check and put quality control measures in place, but we've had to cancel very few appointments because people were ineligible. Most of the issues have been tied to sharing links or QR codes for second doses, but generally we've been in good shape there.